Hi, folks. Today is Thursday, April 23rd, and another day of test results coming in with no new positive cases, and that's fantastic. We don't yet have the final report from Saturday or Sunday, but we understand that all of those results are in with no positive cases, and they're getting in results from Monday. So we're hopeful we'll have the final report from Saturday and Sunday tonight, and hopefully the final report from Monday either tonight or over the weekend, and we'll continue to keep you updated. I was asked if we're testing for active virus or testing for antibodies. This test is for active virus. The antibody testing is not yet available to us. So the other thing that we've been talking about is testing for you, for the independent residents. We had thought that we could go through a process with Convenient MD where through a telemedicine visit you could qualify for testing. It turns out that's not going to work. Basically, the combination of you've been self-isolating for about 6 weeks now, you have not been around anyone who's tested positive for COVID-19, and in addition to that, even if they had, they would have had to be not in PPE. So if we went sort of the standard route, you wouldn't come out on the chart to say you should receive testing. But we do know that there are folks who do want to be tested anyway. So we've had the conversation with Convenient MD, and what they can do is what they call broad-based testing, and they can write the script for you to get tested, and they would come and do it on site. But it will cost you $60, which we would put on your bill and handle all of the paperwork for that. Medicare would pay your actual lab fee, but the testing fee is you would have to pay as an individual. That's the $60, and that represents their time and materials as the testing agent. So we're not sure if that is going to be interesting to people, with the fact that none of our staff who work on the independent living side have tested positive. Your likelihood, your risk is awfully low, but those are point-in-time tests. It's never zero, and so I think some folks might still be interested. We have a memo that's going out tonight or tomorrow. It's pretty short. Give it a read, but we're going to ask you in that to just write back to us. There's a little form at the end to ask you to just let us know if you are interested. That will help us understand if we have enough people who are interested to have Convenient MD actually come and do it on site. So I think that's sort of it for where we are for today. Just another day where science is getting closer here. I've had a number of residents send me articles from various periodicals, some of them very sciencey, which I have to admit I didn't really understand. But just talking about various antivirals and vaccine work that is going to get us closer to a day when this is behind us. And we continue to think about that, but we also continue to focus very significantly on today, on how you are, on keeping you healthy, on keeping our staff healthy, on being a good family and working together to do everything we can to provide community and peace of mind in these kind of crazy times. So thank you. Hang in there, wash your hands, stay 6 feet apart, all that good stuff.